Liposuction was the third most popular cosmetic surgical procedure in 2020, with over 350,000 procedures performed. This finding was according to the American Society of Plastic Surgeons. So, what is liposuction? Is it a convenient procedure? Or is it a risky one? How has it advanced over the years? And what is the future of liposuction? Well, you're about to find out. In this video, you'll get a comprehensive understanding of liposuction and also know if it is right for you. Liposuction, also known as lipoplasty, is a surgical procedure that removes excess fat from various areas of the body. The procedure involves the use of a hollow stainless steel tube, called a cannula, which is inserted through a small incision in the skin. The cannula is then used to suction out the excess fat using a powerful vacuum. Liposuction can be performed on various parts of the body, including the abdomen, hips, thighs, buttocks, upper arms, and neck. It can also be performed alone or in combination with other cosmetic surgery procedures to improve body contours and achieve a more proportionate appearance. Liposuction is a popular cosmetic procedure that is performed to remove unwanted fat deposits and reshape the body. Let's move on to the history of liposuction. The history of liposuction dates back to the early 20th century when various forms of fat removal were attempted using different techniques. However, the modern technique of liposuction as we know it today was first developed in the 1970s by a French surgeon, Dr. Giorgio Fischer. He introduced the use of a cannula and a syringe to remove excess fat through small incisions in the skin. This technique was called lipoaspiration, and it was the first successful method of removing fat through suction. In 1983, Dr. Jeffrey A. Klein, a California-based dermatologist, further developed the technique by introducing tumescent to enhance the effect of the procedure. In the following years, various advancements and modifications to the procedure were made, such as ultrasound-assisted liposuction, UAL, laser-assisted liposuction, LAL, and others which improved the precision and effectiveness of the procedure. Today, liposuction is considered to be one of the most popular cosmetic surgery procedures and is performed around the world. So what are the benefits of liposuction? Is it convenient? Let's go on. One of the benefits of liposuction is the non-invasive nature of the surgical procedure. Liposuction is considered to be a minimally invasive procedure, which means that it does not involve major incisions like traditional surgical procedures. Smaller incisions mean less pain, bleeding, and scarring. This makes the recovery time shorter as the patient does not need to heal from major incisions. The procedure is also less risky and complications are less common as compared to traditional surgical procedures. Another convenient benefit of liposuction is its quick recovery time. Liposuction is known for its relatively short recovery time compared to other fat removal procedures. The recovery time can vary depending on the size of the area being treated, the technique used, and the individual's health. However, most patients can return to their normal activities within a few days of the procedure. The short recovery time can be attributed to the non-invasive nature of the procedure. Since the procedure does not involve major incisions, there is less pain and bleeding, and the body does not need as much time to heal. Also, the recent advancements in liposuction technology, such as tumescent liposuction and ultrasound-assisted liposuction, have further reduced recovery time. Patients may experience some swelling, bruising, and discomfort in the treated area for a few days after the procedure. They may also be required to wear compression garments to reduce swelling and support the treated area. The recovery time can be reduced by following the post-operative instructions provided by the surgeon, such as avoiding strenuous activities and keeping the treated area elevated. Please note that even though liposuction has a relatively short recovery time, it's a cosmetic procedure and the final results can take several weeks or months to be fully visible. Another amazing benefit of liposuction is its long-lasting results. Liposuction is known to provide long-lasting results as long as the patient maintains a healthy lifestyle. Liposuction removes excess fat cells from the body, which means that the results of the procedure are permanent. However, the procedure does not prevent the remaining fat cells from expanding or contracting if the patient gains or loses weight. Therefore, if the patient gains weight after the procedure, the remaining fat cells will expand, and the results of the procedure may be lessened. Similarly, if the patient loses weight after the procedure, the remaining fat cells will shrink, and the results of the procedure may be enhanced. Liposuction can also improve the contours of the body and can make individuals look and feel better about themselves. The procedure can also boost self-confidence and self-esteem. Patients need to have realistic expectations about the procedure and understand that liposuction is not a weight loss solution, but a body contouring procedure. The procedure can help individuals achieve their desired shape, but maintaining a healthy lifestyle is crucial for long-lasting results. Another awesome advantage of liposuction is that it can target specific areas of the body. Even though liposuction is commonly used to remove excess fat from the abdomen, hips, thighs, buttocks, upper arms, and neck, it can also be used to treat other areas such as the calves, ankles, and face. The procedure is tailored to your needs and goals as an individual, and the surgeon can use different techniques and cannulas to remove the fat from specific areas. For example, smaller cannulas are used for the face and neck, while larger cannulas are used for larger areas such as the abdomen and thighs. This makes liposuction a convenient option for individuals who have specific problem areas that they would like to improve. For example, if you're unhappy with the appearance of your thighs, you may choose to have liposuction on just your thighs, rather than having a full body lift. Liposuction can also be combined with other cosmetic procedures such as tummy tuck, breast reduction, or facelift to enhance the results. As mentioned earlier, there have been several advancements in liposuction technology over the years that have improved the precision and effectiveness of the procedure. We'll now go over some of those advancements. First on the list is the tumescent liposuction. Tumescent liposuction is a technique that was first introduced by Dr. Jeffrey A. Klein in 1983. It is a variation of traditional liposuction that involves injecting a solution of saline, lidocaine, and epinephrine into the area to be treated before suctioning the fat. This solution is called the tumescent solution, which makes the fat swollen and firm, and thus easier to remove. The tumescent solution also helps to shrink the blood vessels and reduce bleeding, pain, and recovery time. This makes the procedure less invasive and helps to minimize the risk of complications. The technique of tumescent liposuction is a popular method of liposuction because it offers several benefits over traditional liposuction, like reduced pain and bleeding, reduced recovery time, minimize the risk of complications, greater precision and control. It can be used for larger areas and also in conjunction with other cosmetic procedures. However, tumescent liposuction is not suitable for everyone, and it may not be the best option for certain patients. Your surgeon will be able to assess your case and advise you on the most suitable technique for you. The next advancement in liposuction technology is the ultrasound-assisted liposuction. Ultrasound-assisted liposuction, UAL, is a technique that uses ultrasound energy to liquefy the fat before it is suctioned out. The ultrasound energy is delivered through a special cannula that is inserted into the fat through small incisions in the skin. The ultrasound energy causes the fat cells to vibrate and break apart, making them easier to suction out. UAL also helps to reduce trauma to the surrounding tissue, and it allows the surgeon to remove fat more easily and with greater precision. This technique can be used to treat larger areas and can also be used in conjunction with other cosmetic procedures such as a tummy tuck or facelift. However, it also has some disadvantages, such as the need for special equipment, higher costs, and longer procedure times. Another technological advancement in liposuction is laser-assisted liposuction. Laser-assisted liposuction, LAL, is a technique that uses a laser to melt the fat before it is suctioned out. The laser energy is delivered through a special cannula that is inserted into the fat through small incisions in the skin. LAL can be used to treat larger areas and can also be used to tighten the skin. The laser energy causes the fat cells to heat up and melt, making them easier to suction out. The heat also stimulates collagen production, which can help to tighten the skin. There's also power-assisted liposuction, PAL, which uses a cannula that vibrates rapidly, helps to break up the fat and make it easier to suction out. And the water jet-assisted liposuction, WAL, which uses a water jet to detach fat cells and remove them with suctioning. All these advancements in liposuction technology have improved the precision and effectiveness of the procedure and have reduced recovery time and complications. Now let's move on to the risk and complications of liposuction. Like any surgical procedure, liposuction carries certain risks and complications. One of those risks is bruising and swelling. Bruising and swelling are common after liposuction, and they may take several weeks to subside. Another risk you need to know about is pain and discomfort. Patients may experience some pain and discomfort after the procedure, but this can be managed with medication. Infection is another risk associated with liposuction. Any surgical procedure carries a risk of infection, but this risk is low with liposuction. Next is numbness and tingling. Numbness and tingling in the treated area may occur after liposuction and may take several months to resolve. Another complication with liposuction is rippling or unevenness. In some cases, patients may experience rippling or unevenness in the treated area, which can be corrected with revision surgery. Finally, on our list of liposuction complications is fat embolism. A rare but serious complication in which fat enters the bloodstream and travels to other parts of the body, such as the lungs, heart, or brain, can occur with liposuction. So, how do you know you're eligible for liposuction? Eligibility for liposuction depends on several factors, including your overall health, the amount and location of excess fat, and your goal for the procedure. Good candidates for liposuction are generally healthy adults within 30% of their ideal body weight who have localized areas of excess fat that are resistant to diet and exercise. Liposuction is not a weight loss procedure, and it is not recommended for individuals who are significantly overweight or obese. As a patient, you should have realistic expectations for the procedure and understand that liposuction can improve the shape and contour of the treated area, but it cannot change the overall shape of the body. You should also be willing to follow a healthy diet and exercise program to maintain your results after the procedure. Also ensure you are a non-smoker or quit smoking at least 4 weeks before the procedure, as smoking can increase the risk of complications and impede healing. It's important to consult with a board-certified plastic surgeon or a board-certified dermatologist who has experience with liposuction, who can evaluate your case and advise you on whether liposuction is a suitable option for you. Now, let's move on to the cost and insurance coverage for liposuction. The cost of liposuction can vary depending on several factors, such as the location of the practice, the experience and qualifications of the surgeon, and the extent of the procedure. On average, liposuction can cost anywhere from $2,000 to $8,000 or more. Most health insurance plans do not cover the cost of liposuction because it is considered a cosmetic procedure. However, in some cases, insurance may cover liposuction if it is deemed medically necessary, such as to alleviate pain or improve function. If you are considering liposuction, discuss the cost and financing options with your surgeon. Many practices offer financing plans or accept credit card payments to help make the procedure more affordable. Also, note that the cost of liposuction should not be the only factor in deciding whether to undergo the procedure, but it's important to factor in the cost and compare it with the expected results and the benefits of the procedure. Now let's move on to the future of liposuction. The future of liposuction looks promising, with ongoing research and development aimed at making the procedure safer, more effective, and more widely available. One area of research that is gaining momentum is the use of non-invasive techniques for liposuction, like ultrasound and laser energy. These techniques have the potential to reduce the invasiveness of the procedure and minimize the risks associated with traditional liposuction. Another area of research is focused on the use of stem cells and regenerative medicine in liposuction. Studies have shown that stem cells obtained from the adipose tissue, fat, removed during liposuction can be used to promote tissue regeneration and healing. This could potentially lead to a new generation of liposuction procedures that not only remove unwanted fat but also promote tissue repair and rejuvenation. Also, the use of robotics in liposuction is another promising area of research. Robotics-assisted liposuction procedures are being developed to provide more precise and accurate fat removal and to reduce the invasiveness of the procedure. Liposuction is a well-established procedure, and the future of liposuction is expected to bring innovations that will make the procedure safer, more effective, and more widely available. If you ever decide to go through the liposuction procedure, here are some recommendations for further research. It is important to conduct further research and consult with a qualified medical professional to ensure that you fully understand the procedure, the potential risks and benefits, and whether it is the right option for you. Consult with a board-certified plastic surgeon or a board-certified dermatologist who has experience with liposuction. They will be able to evaluate your case, discuss the different techniques and their advantages, and advise you on the most suitable option for you. During the consultation, ask the surgeon about their qualifications, experience, and before and after photos of previous patients. Also, discuss the recovery time, the cost, and the risks and benefits associated with the procedure. It's also important to note that liposuction is not a weight loss solution, and it's not recommended for individuals who are significantly overweight or obese. Remember to have realistic expectations, and don't forget that liposuction can improve the shape and contour of the treated area, but it cannot change the overall shape of the body. Diet and exercise should be followed to maintain the results and a healthy lifestyle. If you found this video helpful, please tell us in the comment section. Also, don't forget to like and subscribe to this channel if you haven't done that already. See you in the next video.